Landmark articles in neurology that you should know. Today we're talking about the results of the SAHARA trial published in the New England Journal of Medicine behind me. This trial recruited 742 patients at 23 centers around the world. These patients had to be 18 years or older admitted to the hospital with a first-time acute aneurysmal subarachnoid hemorrhage, and within 10 days of admission had to have anemia, which was defined by this study as a hemoglobin value of 10 grams per deciliter or less. So ultimately, these patients were randomized in a one-to-one fashion to receive either a liberal strategy for transfusion or a restrictive strategy, where the liberal strategy was defined as transfusing anytime the patient's hemoglobin value was 10 grams per deciliter or less, and a restrictive strategy employed a cutoff of 8 grams per deciliter. And here are some of the baseline characteristics of the two groups behind me. Ultimately, the primary outcome was defined as an unfavorable neurological outcome at 12 months, where unfavorable was defined as having a modified ranking scale score as 4 or more. Figure 1 tracks the daily hemoglobin levels between the two groups from time of randomization on. Table 2 shows outcomes, where 33.5% of the liberal transfusion group had an unfavorable outcome, 37.7% in the restrictive group had an unfavorable outcome, with no significant difference between the groups. Ultimately, there were no differences in functional outcome at 12 months between transfusions.